Hello, everybody. Welcome. We will begin in just a minute. We're going to let some folks jump on. We know sometimes Zoom can take us a minute or two to get connected, so we just want to give folks a minute or two to get all settled in. Okay, so I'm going to go ahead and get us started, especially because we only have an hour, and I want to make sure that we're able to give Marlo enough time to answer questions and have some discussions with you all. Welcome to Aligning Funding Opportunities in California, the American Rescue Plan Learning Exchange. And so we're really excited to have Marlo Nash back to help guide us through how we can make use of one-time funds for long-term gains for children, families, and communities. And just as a reminder, I know we're probably all Zoom experts by now, but I just wanted to bring your attention to a few features that you may use today during this learning exchange. If you needed to mute yourself, which I believe everyone kind of probably has been muted when they come in, and that's just to help us eliminate any background noise. But in case you wanted to share any thoughts in the conversation, you can always unmute yourself with a little microphone. You can also share your video. We love to see your faces. It actually lets us get to know you better. But if you are not camera ready or you're shy, you can always stop the video and opt not to share your camera. For the chat, if you have questions, you can directly message me. My name is Lydia Marquez, and I am one of the facilitators here today. Or you can also chat on Din, who is also someone who will, our events coordinator, who will be able to help you as well if you're having technical difficulties. The reactions icon is kind of fun to use if you wanted to. You can put a thumbs up, a smiley face if there's something that resonates with you. So feel free to use any of these features today. Just as a reminder, strategies, we provide technical assistance to prevention planning teams throughout California, and we work with county-based teams, and these are our values. And when we're thinking about even just the work that we're talking about today, we always, our work is centered in these values, and that is equity, community voice, strength-based approach, accountability, and collaboration. So these are things that we always think about when we're working with our teams, and these are things we're helping our teams think about in the work that they're doing as well. So today you are joined by myself, Lydia Marquez. I'm a senior technical assistance specialist with Strategies Technical Assistance, and Anvi Din, our events coordinator from Strategies TA. We will both be providing technical support to you if you need it, or answer any questions that we can. Our directors are Sarah Lacroix, who hopefully will be able to jump on, and Michael Williams, who's also a director. But now I wanted to introduce us to Marlo Nash. We had the opportunity to spend time with Marlo during our webinar on the American Rescue Plan Act, and so I will let her take over from here.
Thank you, Lydia. Let me just make sure first that you can hear me. Okay. Is everybody hearing me?
This is the interpreter. I can hear you.
I can hear
Okay.
you too, for what it's worth.
Okay. All right. Thank you. I have several venues of technology going. So you may notice that I'm on live screen, and then I also have a connection that has my photo on it, which I'll be sharing my screen. I just needed different computers for different purposes. And I'm also joined by my phone, so I have my headsets in. So I was worried that in the multi-part configuration that maybe somehow I had lost sound. So thank you for that feedback. In a minute, I'm going to show a few slides just to sort of set the context for today's session. But I really want to emphasize that the purpose of this session is it's entitled Learning Exchange. And so it's intended to be interactive. So I'm going to help support that in terms of kind of giving us some starting points. But I just want to encourage you to raise questions, help me help you get out of the session what you would like to get out of it. I've come prepared as I could be for kind of an open-ended session. So I have some things I can share, but I also just want to make sure that it is if you've come with some specific things you need to know, that we cover that. So give me just one moment to share my screen, and I'll kind of set us up to start. I did suggest in the chat that if you make sure, there we go, that if you would turn your cameras on, that would be great. If not, that's okay too, as Lydia said, but I would love to start meeting you all more personally. So thanks for those of you who are able to do that. So as Lydia said, we're here for a follow-up session to a previous presentation I did on the American Rescue Plan funds and how, giving some background on that and how it might be used. And so just to give you a quick overview of the plan today, the purpose of the session is to share insight and information on concepts, frameworks, resources, and approaches that could be used to further develop functioning integrated systems of child and family well-being. What I understand from working with Sarah and Michael and Lydia is that you all are, many of you, if not all at some level, are working on this concept of systems of child and family well-being, and you may be at different places in that development process, but really the conversation is about how do we continue to strengthen that work. So that's one thing we'd like to do today, of course, in the context of the American Rescue Plan funds. But one thing I will say about what's happening with the American Rescue Plan funds is I think it's just their presence and the way the federal guidance is written, and the many different provisions and the amount of money that's in it, it is causing, it's igniting imagination around the very thing that we would want imagination ignited around, which is systems reform. So I work as a consultant with other states, and I can share with you that in those places, they're saying, you know what, we're gonna do our level best to draw down rescue plan funds. And if we don't do that, we are going to be, we are going to be better for having done the work to try to do that, because they are all trying to do, really think about what are structural inequities, what are the social determinants of health or the root causes of that disrupt child and family well-being, and using this this open window of opportunity, or maybe it could be described as a sense of urgency to try to draw down rescue plan funds as a way to spur their efforts generally. So for that reason, I really encourage you to advance on this and attempt to get rescue plan funds, but the process will be valuable. We can talk more about that. We want to receive and respond to questions about the American Rescue Plan Act. We want to hear from you what your questions are, and then respond to the ones that we can, and anything we can't follow up, we can't respond to today. I'm committed to following up if I have to do a little research to get you an accurate answer. We want to facilitate cross-community sharing of successes and challenges. So that means we would love to have you all tell each other what kinds of things, particularly if you've had successes, but also if there are challenges that you want to kind of unpack today. And as we're unpacking those, I'm I'm happy to be helpful. That's why I'm here, but I also recognize that you all may be even more helpful to one another on certain topics. And so we'll want to make sure that we're having that cross-community sharing. And then we want to generate any follow-up needs and our opportunities. So if we learn today that there are some specific tools you need, or a drill down even more deeply in one aspect of this work, that kind of thing, we want to try to track that today. So out of today's session, we hope you have increased knowledge about strengthening systems of child and family well-being. You have improved understanding of accessing rescue plan funds and applying them to achieving outcomes. An initial idea bank from other communities that are using or seeking ARPA funds. A set of questions identified and answered or documented as a follow-up, as I mentioned. And at the end, we're going to ask each of you to identify one next step out of today's conversation. So I want to just share some potential topics. In a minute, I'm going to ask you each to share what question you've come with today, or at least one that you've come with. But I also, before I did that, I wanted to give you some idea of what kinds of things we're prepared to answer today, or at least discuss. But we can also, if something you want to talk about isn't on this list, we can certainly talk about it, or at least raise it and learn what's on your mind. So we have it teed up to share what some other California counties and even some other states are doing to draw down rescue plan funds. We could talk about communication and advocacy, for example, applying framing science to make the case for rescue plan funds. Systems of child and family well-being, I've already mentioned why ARPA is a resource and catalyst. I actually already spoke to that. The social determinants, as I mentioned, a potential framework you could use, and outcomes, and the concept of outcome rate cards and how that might apply to drawing down rescue plan funds. I know there were questions after the last session about mobile crisis intervention teams, so we can touch on that if anyone who's joined today has that question as well. We can talk about a framework for helping systems become trauma informed based on some work I'm doing nationally. I'm happy to share that with you. Sustaining efforts post-rescue plan funding. That's a question, that's out there, and I shared very briefly and quickly some ideas when we did the webinar a couple weeks ago, so we could revisit that topic and go a little more deep into some of those ideas. With the child tax credit is an important activity right now that everyone should be involved in ensuring that the families you serve are accessing the tax credit. And then, of course, anything else that you may come up with. So I want to do a check-in, and I think I think we have a small enough crowd that by doing a live check-in rather than using chat, I think we can we can achieve it. Actually, I'm going to do a combination of both, just in the interest of time. So first, if you could just chat your name and the community or county you represent, so we can see that in the chat. Just take a minute to do that. And I'm gonna, as I'm juggling my different technologies here, I'm gonna open up the chat so I can see as you all introduce yourselves. All right, thank you, Leslie and Michael and Bo. And I think that the counties you're from are more helpful information for your colleagues than for me. I'm not a Californian. I know some of the state, but I appreciate you sharing it, because I do think it's helping your colleagues kind of understand who's here with one another today. Okay, thank you for doing that. Now we'll go to the next one. Is just And just briefly, how are you doing today as we come into the session? This will just help me know kind of how are you with all that's going on. I'm going to watch that for that in the chat, and then I think the next two questions we're going to go live. And Lydia, when we work through answering the next couple of questions live, can you help me make sure that we've called on everyone who's participating?
Yes.
Okay, thank you. And then for those participating, we've gone live, but if anybody is unable to bring your sound on or anything like that, just let us know through chat, and you're welcome to chat. But hopefully we can have people, we can have some conversational interaction. I'm so glad to see that people are doing well and have good news. I'm so glad, Lola, you got the tickets you wanted. That pumpkin spice coffee is going around. That's awesome. Excitement about the work, a busy and productive day. That's great. Great. I'm not sure we've heard from everybody. Yeah, so yeah, Adam, you're missing rain. I think there's quite a bit of it going on in some parts of the country. Anybody else want to weigh in on that? Okay, I'm gonna, in the interest of time, I'm gonna move us along. But what is one question you bring to today's session, or one aspect of the topic you want to see addressed? And I really would like to have everyone respond to that, because that's really going to help us launch this the next few minutes of discussion that we have. So as you can see on the screen, I'm going to actually track. I'm not going to obviously track the two questions I've already asked, but I do want to track the question that you have. And so I'm going to ask everybody to give me at least one question you come with today. And are they able to unmute themselves, Lydia?
I believe so. Yep.
Okay. Okay, so Lola, I see yours. Is anyone tracking how individual counties are expending these funds? And I'm gonna, while I type that, throw that question actually to maybe Michael or Lydia. Do you know, for specific to California, if anybody's tracking?
I don't know. So Marlo, because it goes straight from the federal government to the counties or the cities, right?
Well, some of it goes through the state too, though.
Yeah,
Well,
so that's great. I'm
yeah.
happy to help quickly clarify. So so first of all, the American Rescue Plan Act has multiple funding sources. So there's the Coronavirus Fiscal Relief Fund, which every state got money, every county in the country got money, and then a number of municipalities. And in California, it's around 90 of your cities got direct funding from the federal government. And then something called non-entitlement units, or NEUs, which are communities of 50,000 or less. They also got some money from the federal government. And tribes had access to money. The amount of money is not is going to remain confidential, but some of your tribes may also be drawing down funds. That's one of the provisions of the American Rescue Plan. There's also the, I'm sure you've heard of the early elementary and secondary education emergency relief fund, ESSER, that went to the state education agency, and then all LEAs received some of that directly as well. So there are different funding streams. And I had a slide on that the last time we talked. I'm happy to pull that back up if that's helpful. But tracking, if Lola, your specific question is how are counties spending the county money, I think that it's not sounding to me like at least anybody on the line knows that California is specifically doing that. I don't know for sure, but I would anticipate that potentially a national association of counties is tracking that. And what I will do is make a note as one of the things to follow up on. All right, so now I'm going to go back and see if somebody who chatted a question, if you're able to share it, that will help me because I'm trying to watch and type. I saw Michael's question about, oh, it went away. It scrolled up.
I can say it.
Prevention advocates.
Yeah, just how,
Okay,
how our
got it.
prevention advocates in counties working, interacting with their board of supervisors and their city councils to influence how the funds are being spent.
Yeah, so that'll be a conversation we can have among folks who are on the call. And
There's
then,
oh, sorry, Marlo. There's another question.
go ahead. Yeah, if there are other questions.
So Laura was asking about how other counties are using the funds. Her county is still considering how they're going to use it, and they're still planning. So Laura is from Contra Costa County. So I don't know if our northern folks might have some ideas on how that funding or heard anything about that.
The one thing I can
Okay,
speak
I
to
also
is
saw the
LA
note.
County actually has has their plan already and has it detailed. Here are all the different pockets and the different things that we're doing. So I don't know whether any other county is like that, but LA County does have that.
Yeah, and I actually, if folks are interested in it, I have that kind of teed up, the ability to show you all some of what LA County has done. So we can do that at this time together as part of answering that question. So I was hoping in terms of format that everybody on the line would submit a question, at least one question. But in the interest of time, I'm going to go with the ones that we have. And I'm going to just back us up one slide to ask one other check-in question. And that is, and I'm going to leave it here in just a couple or a few words. What is one way your work in your county or community will benefit from today's session? So in a sense, I'm asking you, what do you hope to get out of the session so that I can be sure we work toward that. And I appreciate the questions you submitted a moment ago, because I'll jump to those in just a moment. And we'll use that as our way to start engaging. And Laura, I will share the slide with the funding sources in just a moment. But can folks either out loud or if chat is easier or more comfortable, how will your work benefit? In just a few words, how will today's session benefit your work? Okay, from Leslie, more concrete ideas. Okay. Are there any other answers to that? Okay, here we go. That's great, Lola. And expand. So Bo is asking, can you expand more on how to access the community mobile cart? Yes. Yep. I'll do that. Let me capture it. And Michael is, you feel like you'll identify strategies to replicate. Okay. All right, Mickey, that's great. I'm glad you're here to sit in and learn more. That's great. So as we go, Mickey, if we touch on something you want us to go a little deeper in, if that will help your learning, let me know. Okay, so I invite you to continue to share, but I'm also going to go ahead, since we've got some things we know people want to learn about, I'm going to jump around here a little bit. And I'm going to go first to the funding sources slide. Let me just pull it up quickly. So this is what I shared last time, and this is not an exhaustive list of rescue plan money, but it is, it's the funds that I think are probably most relevant. So I mentioned the coronavirus state and local fiscal recovery funds, and in my mind and in the work I'm doing, I feel like this is the one that's igniting the imagination, because the federal guidance that came down for this money, well, first of all, there's a lot of it going across the country. There's a lot of money, and the federal guidance said this money can be spent on situations that were caused by the pandemic or exacerbated by the pandemic, to include the kinds of things that you all work on. So essentially, you see my bullet point here is that it can be spent on the root causes of child maltreatment, because we know that housing, financial instability, and childcare are three of the leading causes of child maltreatment. So, and we know those were all issues. We know that racial inequities are a problem, and those are all in that. And we know that the pandemic shed light on that and made that even worse. And so that's something you can be thinking about with these funds. So this is, and the way that the guidance is written, there is a lot of leeway to spend these funds on what would ultimately, result in a system of child and family well-being. And they also can be spent against one of the emerging, really challenging problems. And I spoke a little bit about this in the webinar, that we know that infants born during the pandemic, there's research that suggests, and we're waiting any day now, it will be a published peer-reviewed article, and we'll feel more solid in being able to say this. But there's a lot actually of evidence that suggests that infants born during the pandemic are significantly behind in verbal, motor, and cognitive functioning, and that is, as we speak, as time passes right now, that's evolving into changing the architecture of their brain. And so the kinds of things that need to happen to combat that problem are allowable by these treasury funds. So your state got $27 billion, each county got some. Alpine County is the lowest at $219,000. Los Angeles County is the highest at $2 billion. As I said, about 90 metropolitan communities got money, and this money can be stacked. So all these different levels of government got money. And if you can work with your county and your municipality or municipalities, even within one county, to say, we've got a plan, and if each of you put in this much, you can, we can reach every family with home visiting, for example. So that's the kind of thing. But everything is disjointed unless you make it connected. So there's not necessarily folks thinking about, for example, this infant and toddler issue that I talked about, unless you're talking about it. There aren't necessarily people thinking about, oh, there's this possibility of a system of child and family well-being, unless you put together that framework and present it and talk to them about it. So you see there's, to the state, $3.9 billion coming for child care support, $34.9 billion to education systems. The $29 million are probably have heard about and are familiar with for CB-CAP grants. There's at least $4.4 billion for housing, if not more, and some to your mental health and substance use block grants, supplemental funding to that. I don't have it on here, but that some went to the community action agencies. Nationally, Head Start's got $1 billion. And then there's the community mobile crisis intervention services. So that's to give you an idea. And what I would encourage you to think about in your planning is accessing any of these funds, because part of what's happening is in some cases, there's so much money to spend and not enough ideas on how to spend it. And I think that could be true, for example, if you're in a county that maybe has more rural areas and you've got local education agencies or school districts that have gotten significant amounts of money, but maybe don't have staff capacity to really, think through what are the ways we need to spend this to really, stabilize our student population or even our future student population, because that education money can be spent on early childhood, but is not necessarily going to be unless there's advocates who work, and stakeholders and partners who work with the local school district to help them understand what the issue is, the fact that they can spend on infants and toddlers, and what they might spend money on, like evidence-based practices, like home visiting, that will really work to recover the losses that infants and toddlers have experienced. So now, Lydia, I'm going to ask for your help. I'm seeing you chat to kind of help me know where the next best place to go is based on what people are asking for in the chat, or what you saw in the questions from earlier.
So Lola had mentioned or had asked about the study that you referred to that's being peer reviewed. Like, where would we look out for that once it's been published?
So once it's published, it'll be a JAMA Pediatrics. I spoke to the researcher last week. He was hoping it would be in the next couple of weeks. And I'll tell you what I'll do. I don't want to use up time now, but I will send as a follow-up the link to the preprint of the study, which is public, and then also some other sources for how young children are doing, so that you can look at some other data as well. So that's what we can do for that question. Is there another one, Lydia?
Yeah, so it looks like folks are really looking for concrete ideas on how to just access like the funding, and how to, I think, use it to build better infrastructure. And then also there was some questions around like the childcare portion, like how to access that, to, I guess, look into how to access that for the childcare. And then someone had just, I think, asked, I'm trying to go through all these. I lost it. And then also, I know earlier Bo had asked about community mobile crisis intervention. And I know that you said you were going to talk about that as well. So just as a...
Yeah, so let me go there first. And I should have waited to stop sharing my screen. So give me just a minute. I'm going to go back to the slides, because that's where I have some information around the mobile crisis services. So let me do that. Okay, all right, here we go. So that is, okay. So just some basic information about mobile crisis intervention teams. So the reason they are kind of on the menu today and in rescue plan discussions is because the rescue plan authorized in California, it's a 90% federal match, because for states that are Medicaid expansion states, they got a slightly higher match than other states. So 90% federal match for mobile crisis intervention teams. These teams have to be trauma informed, and they're related to addressing behavioral health, like substance use disorders, and also mental health issues. To find out the best pathway I could find to help to tell you to find out more is to link to your state National Alliance on Mental Illness chapter, NAMI chapter. And I have a link here, and you'll get these slides as a follow-up today. But there are also many local NAMI chapters in California, so you could even start there. You want to start with the one in your county. And I think it's a little bit of an investigation process to find a person, either local NAMI or state NAMI, who is working on this. But I have to believe in California there is someone in either your local or state NAMI office who's working on this and would be able to give you the information you're looking for. And I want to encourage you all to do this. I think the question would be, do we have them in our county? Or is anyone in our county thinking about bringing them? If not, can you be an advocate for bringing them? So going down this road might put you in a position of being that advocate to even bring them to your community in the first place, or it might identify for you that they already exist, or maybe someone's already working on bringing them because of the Development and the Rescue Plan Act. And by the way, that's a 5-year commitment through the Rescue Plan starting in April 2022. So new ones that sort of were launched because of the Rescue Plan provision are potentially in planning stages, and then in April 2022 they'll have 5 years of that funding. Now, this is one of the kind of one-time funding components of the Rescue Plan, because after that 5 years of 90% match, it will have to be sustained through local resources. But I want to emphasize for mobile crisis teams and anything else we talk about to not be deterred by that, and don't let others have you be deterred by this one-time funding. Because here's how I would suggest that you think about that, and even think about, you know, how you would frame it this way for others, is in 5 years, you will be able to demonstrate proof of concept. You will be able to see if you're getting valuable outcomes from the investments. And so it's well worth investing in people, the people needs that you see, the family needs that you see, in ways that, you know, then will have been shown to reduce cost to public systems. And if you show that, if you make progress toward outcomes over time, you're going to have stories to tell in your advocacy, and you're going to have time to do some work to get funding streams shifted. There's no magic answer. There's no guarantee. But if you don't do that work, certainly it is most certainly not going to happen. So I think this is where that igniting the imagination and really grasping onto a new opportunity that the Rescue Plan dollars offer. So then you see my note here that says, even if your community, if you find out they have crisis intervention teams, it's still important for you to get involved in this if you haven't been before, because what I've learned from doing work in other parts of the country is that they're often not family-centered. They are required to be trauma-informed by the American Rescue Plan provision in order to be reimbursed at that 90% federal match, but are they really? And if you are an organization that knows a lot about, excuse the dog barking, knows a lot about being trauma-informed, you might be a resource on that topic for them. If you do trauma-informed training, or you have a partner who does that, making those relationships could be helpful. Do they need more knowledge about interacting with infants and toddlers, children, and youth? So if the CIT in your area is mostly focused on interacting with adults, you know that many times they're going to go out on calls with adults where there are children present. Have they done any thinking about how that traumatic experience affects the children and what could be done about that? So you may be a really helpful partner for them around how do they think about the needs of the children in those kinds of high stress situations. Do you know, you may have or know about resources that they might find useful in terms of referrals, and you could investigate with them, work with them to figure out how you could be a partner or how you could integrate what you know and what you do with their work. So then I'm offering up a couple of links that you'll have after today to read a little bit further about all that. So that's mobile crisis intervention teams. And Lydia, can I ask you, did any follow-up questions about that?
Well, and thank you, Marlo. I do appreciate you, bringing that up and discussing kind of the ideas. We do have a local NAMI person here in Ventura County, so I will reach out to that person. And then part of my question too is we have what's called the Family Urgent Response System across all of California. So that's brand new as of kind of July-ish of this year. Do you think that's something that qualifies? We also have like a crisis team within Ventura County that's more run by our behavioral health team. So I'm not sure if any of those qualify.
So I've noted, I think unless someone on the call could answer that question, I think that either I or Sarah and Lydia, the team, it's something we might need to look into. I think it's a great question. And I think it's a great example of how there's this alchemy of what's going on in any given state and the rescue plan funds, and how do you make those intersections. But I think it's absolutely worth, digging around a little and finding out if anyone's already made that connection, or if they haven't, if the connection is there and there just needs to be, some communication and networking done to help people see that connection. So I've noted it as something to follow up on, unless someone on the call can provide an answer.
I'd like to point out one thing that's just kind of adjacent to this topic, having to do with mobile crisis intervention. The state is also dealing with, and all states are also dealing with, is the switch over for in July of 22 for the 988 mental health emergency hotline. It'll be much like 911 for medical emergencies, for mental health, and the state's kind of trying to grapple with making sure that it's not just operators kind of being able to talk you through things, but actually people coming out. I know we tried to get some funding for that. It would be a like a charge on phones, like the 911 fee is. And the big argument that the telecommunications industry kind of pushed back on was, how much should it be, and should you actually include this? But that just almost seems like it interplays with that. It's Assembly Member Rebecca Bauer-Kahn was pushing that with the Miles Hall Foundation out of Walnut Creek. So it just, if there's money from this, and if we get some amount of money from that, that might be kind of a way to, to get it started. But then, after 5 years, that can be perhaps the sustaining factor. It's just also another thing to advocate around, because it just all ties in.
Yeah, absolutely. Thanks. That's helpful. I'm going to share well, this is the version I have. So again, in the interest of time, I'm going to go with this. This is what LA County has done, and I know that the amount of money LA County gets I know that sometimes it can be an apple among oranges. So this is not necessarily, I'm not showing this to say your county should just take and do this plan, because it doesn't work that way. But I did want to offer it up to you as a really good example of how, what's clear to me in looking at this, that LA County had done a lot of thinking before the pandemic about how to address structural inequities, systemic inequities, about how to integrate and address financial instability and housing instability sort of through one program. And so what I just want to say a few things about this plan. I want to make sure you know it's out there. We'll send you links. It's not hard to find though if you Google it, but we'll send you links. But what I want to point out is they have these strategic pillars. There's just some things about it that you could borrow from. So these strategic pillars of equity-focused investments, building a bridge to an equitable recovery, fiscal stability, and social safety net. You see their language there, addressing longstanding inequities in hard-hit and historically disadvantaged communities through urgent, transformative, and innovative investments. So deploying supportive services through an equity lens to jumpstart recovery in communities that have experienced the most severe impacts of COVID-19. And I'm not going to read all of this. I don't have time to do that. I will just say that what I've noticed in here is they're strong in integrating equity across all the things that they're putting into their plan. They have a way that they've woven through all of it, grants to community organizations so they make it clear how they're going to funnel this federal money to community-based organizations to do the work, which we know a lot of nonprofit organizations got hit hard by the pandemic, and bringing them into being able to be a part of the recovery is a really important way to use this funding. And this plan is very thoughtful about that. There are interesting ways that they are, like I said, integrating housing needs with workforce needs and financial stability needs. So I found that very interesting. So it's just a great example, not necessarily for the things that are specifically in it, because that may not translate well to your county. But there are those too, though. I think there are some ideas in it that are probably replicable in other counties. And then I think the other thing I would say is if you're in a county that has not developed its kind of its coalitions, its framework, its strategies to a level, if you're feeling like it's true across a lot of this country, gosh, now there's finally money to do these things that we've needed to do for so long, and we don't have a plan. Because what you are possibly seeing is that communities or organizations that already had a plan are, able to jump into this work faster. And I would just say to you, I would not let that be something that keeps you from accessing the funds. I would say, let this, again, spur that imagination, spur that activity to think about, okay, now that there's this one-time opportunity for funds, how can we use that? But then how do we set ourselves up so in the future, if there are other funds from other sources, or even funds that flow maybe from the federal government, but not this influx of funding kind of all at once, like the rescue plan. That's what's unique about this, is so much money all at once. But that doesn't mean there's not going to be money flowing, to the kinds of things you would put in a system of child and family well-being in the future. In fact, there are things going on right now. So Congress is asking Medicaid, federal Medicaid, to look into how Medicaid could be used to spend against adverse childhood experiences. So if they do that and they find all these ways that Medicaid can spend against adverse childhood experiences, you all know that work, you know what those adversities are, and you know that means that there's going to be more Medicaid funding to do things more upstream. So this is what I'm saying, why it's worth it to activate now, kind of regardless of the outcome of getting rescue plan money. Of course, my hope for all of you is that you get some. That's the whole point. But I'm gonna stop sharing that. We'll share links to that. They have a slightly longer version of that document that gives you a little more detail. They do put money into home visiting. They are thoughtful about families. One critique I would offer is that they talk about addressing trauma, but it's really in that space of trauma and violence. So it's more centered around domestic violence and, kind of those ways we know, in fact, for sure, that trauma has been occurring. But what I want to suggest to you is that the pandemic itself is a trauma, and that your workforces are traumatized across childcare, across human services, and other frontline kind of essential worker settings. So there's a lot of trauma beyond what we know is traditional traumatic situations like domestic violence. So I think it's time to, it's a good time to think about how would you have all your systems that children and families may engage with become trauma informed. And there's certainly money across multiple rescue plan funding streams that could set up a way that you offer training and coaching and support to make your systems trauma informed. And I could, that's a topic we could have a whole separate conversation about. I'd be happy to, if we end up continuing this learning exchange and want to go into these other topics in the future, we can do that. Lydia, are there other questions that I can address?
I don't see any, but I did want to just say I did drop a couple of links for anyone that needs further information. There's one from the California Legislators Association on just like the general information on ARPA distribution, if anyone had questions about like how our state determined the distribution. And then I know we were, some folks were asking about the tracking of the funding. I think that I found a page around how states would be reporting the use of funding. It's a little bit heavy and technical, but I think it could give you some ideas on, what kind of information they may be asking for. And it looks like they're still figuring that out, like if there's specific data sets that they're tracking. It looks really general right now. So, excuse me, if there's anything else that we find later on, we can send in the follow-up email to you all. So hopefully those are helpful. It reads a little bit like IKEA instructions, but it can give you some basic information.
I know earlier there was a question or maybe a comment or both about childcare supply, and going back to trauma-informed systems, I think there's evidence out there that if we can help make early care systems, including childcare, obviously trauma-informed, that it lends to staff retention. And I know that, that's a big issue right now. And your state did get a lot of money to help address the childcare crisis. And then, of course, we're watching the federal infrastructure bill right now to see what comes out of it, because there may be additional money for the child care infrastructure. But the current money, if you're not aware, there's a portion that goes to out to child care providers and grants to the providers. So a pot of money came to the state, the Child Care Stabilization Fund, and they are required, they can keep 10% of that pot of money, but they're required to push the rest of it out directly to child care providers. And then those providers have 6 ways they can spend it. And 5 of the ways are business related. So modifying the environment so that they can keep people safe from spreading COVID, PPE, workforce recruitment and retention, I can't recall all 5 off the top of my head, but it's another thing we can send a link to you so you can look into it. But the 6th item is addressing the mental health needs of staff and children in care, and that's where those grants to providers could be spent on, getting some training in how to be trauma informed. But because of the nature of that work, what's happening is the child care providers in your counties are getting that money directly. And so one of a potential opportunity would be to say, can you convene child care providers in sort of a shared activity that they buy into, they use some of their grant money to buy into. So, and that can be for trauma informed or for, other opportunities. But I think that I'm part of a national community of practice that involves state offices of child care, the administrators, but also just some of the senior staff. And I was they're very overwhelmed in trying to think of how to spend this money. They are contacting providers to say this money is available. The providers don't believe them. They think it's a scam, so they're deleting their emails. So there are complicated. So you could be helpful if you've got relationships with child care providers. You could be helpful in saying to them, "It's real. There's actually really rescue plan money for you. So if you're hearing about it from the state, you should click into those emails and learn how you can get money, so you can be helpful in that." And I will just, as I'm kind of vamping to see, Lydia, stop me if another question has come in, but I do want to make sure that you are all, either you are active in, or you are assured that someone is in your county is active in making sure that families are accessing the child tax credit. So you probably are aware that if their income was so low that they did not have to file taxes last year, they are eligible for the tax credit, but they are not known to the IRS. So they need help. People need to know that. They need help filing. And when they do, they can access stimulus checks they may have missed because they are not the IRS, and they can access that child tax credit. And we will find out when when the reconciliation bill passes in Congress, we'll find out if that child tax credit is going to be extended. The last thing that I heard was in the current version, it extends it for 1 additional year. which is not the best thing for families, but at least it's not going to stop in 2021. So it's worth the effort to make sure families are getting that. So that's my plug for the child tax credit. Is there anything else? We just have a few more minutes, and I do want to check out with you all and hear hopefully a little something from everybody. But does anybody else want to raise a question, like one more question for me to handle?
I don't see anything in the
Lola,
chat so far, but I think Lola shared some resources and information. So I think that's, if anyone wants to take a look.
Yeah, thanks, Lola. That's great that the Child Care Resource Referrals provide trauma-informed practice training. And I don't know the nature of that program, but what I would suggest to you is that what we know is that, like, one-time training does, it raises awareness, it's valuable, it has an effect, but that especially in this time when we know that, that as I referred to that study earlier about infants and toddlers, we know that infants and toddlers need deep support for recovering their cognitive, verbal, and motor losses. If they don't recover them, many of them are going to have special needs. Certainly when they enter school, and maybe some that follow them for the rest of their lives. So it's an important time to really make sure systems deeply understand how to recognize and respond to trauma. So awareness is the place to start. But there's a framework we're developing nationally that I'd be happy to share with you if we want to schedule another time. And there's work actually, and I can share links to this. We've done webinars on this. New Jersey, for example, after Superstorm Sandy, identified they had experienced a population level traumatic event, and they at that point started a process for making sure that all their early care environments are deeply trauma informed and trauma responsive. And so they're a good model to look to. So I can share some resources as follow up for a webinar if you want to watch it, and also just contact information for folks to contact. Okay, so Nikki wants to make sure the link share in the chat will be available after the chat, Lydia. I know you'll save that and make sure that gets shared.
Yeah.
Okay,
we'll send that out in the follow-up email. So anything we shared today will be in there as well. So
great, thank you. So this hour went so fast for me. I hope that the information I shared was helpful to you. I would love to hear if you want to unmute or if you want to type in the chat from each person, one next step you'll take after being part of this conversation. And even if that next step is to say you would like to go deeper in any of the topics that I just kind of touched on at a high level today. Anybody want to go off mic and share a next step that you have in mind?
I mean, this is Leslie. I will just say, I didn't know what I was getting into today, right? I mean, so I am with child welfare and have been very focused on our child welfare specific funding. So for me, right, this is kind of being yeah, there's so many different things, right? And a bigger picture. And so for me, it's just about figuring out, because I know we put in asks for the funds, but we really did not get any funds, but I don't know where all of the funds went. So getting a better idea of, as a county, what our, what our overall plans and strategies were and where the funding is going.
Yeah, and I'll tell you that a couple of places I'm working, the child welfare stakeholders are getting together around this framework for a system of child and family well-being, and it's having the effect. In one place I'm working, a completely unrelated federal grant, unrelated American Rescue Plan, but the state got this large federal grant, and they went to the group I'm working with, and they said, "Hey, we know you're doing this framework for rescue plan funding. We have this other pot of money. Could you use some of it?" And so this is what I mean. It's causing them to go, oh, wait, somebody's finally talking about how do we think about getting at the root causes of child maltreatment, not just training parents on parent skills, but really looking at housing and financial instability and the social determinants of health and all of that. And so it's causing people to starting to align in their thinking. And this is what I mean by I think the rescue plan is sparking imagination, and it's like it's a beautiful latent effect of the money that even, you know, just having the conversation and just having this opportunity to think, oh, our governments can actually fund cross-sectionally. They don't do it very often, but look, it's possible. And so now it's causing new things to happen. In one place I'm working, the housing, I'll end on this because there's an upcoming webinar in this series on housing and homelessness, and I hope all of you sign up for that. But the child welfare stakeholders understand now that housing is one of the main drivers of families into the child welfare system, but they weren't working on it because they're providers of evidence-based practices and they're providers of residential services. They sort of thought in that silo. And when they looked at the data and said, oh, housing, we need to be working on that, they realized we don't even know a single name of a person in our state working on housing. We need to start there. So they had a conversation with folks that work on housing. The housing folks said, oh my gosh, we mostly work on veterans and people with disabilities because we don't have any partners who work with families. And yet we know we have this terrible problem around housing and families. So we're so happy you reached out. Now they're talking and now new strategies are happening because of it. So I want to excite you about the possibilities. Anybody else want to, I know we're 1 minute over, so maybe Lydia, you may want to close it out to advertise those upcoming webinars. So I'll toss it to you.
I do actually. Thank you. Thank you so much, Marlo, for your time. We really do appreciate it. And, you know, since this is such unprecedented funding, I think as much information as we can all get and on how it might influence our work or touch it is helpful. And, you know, as we are continuing to see just funding increase in different areas of our state, we are continuing this aligning funding series with 2 more really great webinars. One is, you know, funding to reduce homelessness, which I think will be helpful in understanding how that will be working. We have Althea Linus Fernandez from the CDSS, actually, sorry, this is incorrect, CDSS, who will be with Elena Fiallo from Population Change Institute, and they'll be talking about how that funding is coming down. And then the Associated Learning Exchange for that will be November 16th. I put a flyer in the chat, so if you wanted to sign up, those have links that you can click on. We're also going to be talking with Jose Vargas and Janice Connellan from the United Way to talk about community schools funding opportunities, which is really, I think, important in understanding how, you know, especially if you're working in family resource centers, how some of that funding may be able to be accessed. And then the Associated Learning Exchange session for that will be December 7th. So these are all things that are coming down for our events. I recommend, if you haven't joined our newsletter, to please do that on our webpage, strategiesca.org. You can also connect with us through LinkedIn and Facebook, and we also have a YouTube channel. So we will actually put this on our YouTube channel and send a link in the follow-up email. So for all that participated today, we will send an email just giving you all the links of all the resources that have been shared and any additional information that you might find helpful, as well as the YouTube link so that you can watch this in case you want to go back and hear any of the additional information. So you can also follow us on YouTube for any other additional, I could talk this morning, content that we may have to bring to you. So we appreciate your time today, and we really hope to see you at some of our future events. So I'm not sure if there's anything else that anyone else has to share, but we appreciate your time and your interaction today, and hopefully you can use some of this to further the work that you're doing. So keep doing the good work, and have a great rest of your day.
Great.
Thank you, everyone. I put my
Thanks, Marlo.
contact
Thanks,
information
Lydia.
there
Thanks,
if anybody would like to talk further.
Oops, and before you leave, if you could fill out the Survey Monkey to let us know how today went. And if you didn't capture it, or you can't, click on it fast enough, or it's not working for you, please just know we will go ahead and send that out in the follow-up email. So if you get that, please feel free to let us know how things went. Thank you so much.